you. Okay, everyone, I got straight up 1 o'clock, so let's go ahead and get started. My name is Brian Dowd. I'm the Deputy Executive Director over Policy and Compliance, sorry. And today we're going to do our 5th monthly EVV Town Hall, and it's going to be focused specifically on training. Before we get started, I just wanted to go over a couple of things. If you're going to do any Q&A, please put that in the Q&A box and not the chat box if all possible, because there are different boxes for us and it just makes it harder to communicate back to you. If you can, please focus your questions today on training. We'll answer whatever questions, but focus your questions on training. I also do want to announce that outside of the trainings and town halls we talk about today, the department has decided that it will set up some individual focus groups for participant-directed families at the end of this month or early next month. We've got to get it scheduled on our calendars, but there will be focus groups specific to participant direction that is at the end of this month or the beginning of next month. So just continue to monitor the website and your email and your fiscal intermediary sites for that information. Okay, thank you. So we always start with the mission of the Georgia Department of Community Health, which is to provide Georgians with access to affordable quality health care through effective planning, purchasing, and oversight. So in today's presentation, we're going to do some quick EVV reminders, give you a status update on timelines, talk about the functionality phases, kind of the phases of what's coming next for EVV, go over the communication resources, and then Joe's going to, from TELUS, is going to take us through a training overview and a third-party EVV vendor update, and then I'll wrap up with a little bit of Q&A. So we wanted to do some quick reminders. I continue to get a lot of questions around what services are impacted. I got, I think, 6 yesterday that were just on things like, is CAG covered? Is CRA covered? So these are the services that are impacted by EVV. CLS, consumer-directed CLS, consumer-directed personal support services, personal care support services in the GAP program, and personal support services. This breaks it down by waiver. These are the only services that are impacted by EVV. So any other service that's in your head, if it's not one of these, it is not impacted by EVV. Next slide. Sorry, Joe. So where are we? What's the timeline in the status updates? We are on schedule. We're still working with a lot of the third-party vendors. So we're working to get them, the ones who are wanting to integrate with TELUS. We have an attestation, which is a contract that we go through. And then we go through some testing to get them fully on board. So we're working with a whole bunch of third-party administrators. The call center will be available on 3/29. So that'll be up and running, which is great news. As of March 16th, we're really going to do the new intensive provider training. We've been doing training since 2019, so that's a little bit of a misnomer. And I know many of you have been on the monthly presentation town halls that we're doing since November, and that's training too. But an intensive training starts March 16th. Then we're going to do full-blown provider registration that is available for everyone on March 29th. Effective April 1st, the system will be up and ready. Training, the initial training will be complete, and we'll be doing ongoing support and training, which is going to be available through multiple platforms ongoing. In May, we will really be ramping up our recruitment campaign. And I got a question last night in the town hall as well. What's a recruitment campaign? A recruitment campaign is just us reaching out to providers to explain that as of July 1st, EVV is mandatory for claims processing. So we need you to register and get on board so that we're all on the same page when that claims processing becomes mandatory. In May and June, we'll also be doing system refinement based on the initial input from folks using the system. We don't anticipate any like show-stopping defects or even big defects, but there may be some small cosmetic things that we need to do. So we'll be looking at those and taking care of them for July. Next slide. Sorry, I got a drink. Sorry, everybody. Let me get a drink. So my voice is getting a little froggy. Okay. So again, phase one. What are we doing in the phase one? That's when the full solution will be available, the mobile application, the administrative portal. You'll be able to look at dashboards, reporting, and scheduling. You'll also be available, if approved from the state, to use telephony. So you'll use a phone if you've been approved for that. And the call center becomes available. In phase two, we're going to do claims submission. And we think that'll be sometime in May, maybe late May, maybe earlier, where you can actually submit your claims through the telesystem directly to MMIS. And in late May, early June, we expect the fixed devices to become available. Phase three is that 7.1 implementation, and that's when claims will have to be submitted through the EVV telesystem in order to get paid. And we'll also fold in our case manager support coordination functionality, that window for case management to look into to see how, if there are provider performance issues, or to get alerted through the EVV system. So again, what do you need to do during phase one as a provider? So you need to register your administrator or administrators for your agency. You need to work with your aides to download the app. You need to register your aides as users. So those users are going to need to be registered. You're going to need to load the schedules for your members. You need to complete training and work with administrators and aides to complete that training. You're going to want to determine if any members will require the use of a telephony or a fixed device, and you're going to want to fill out the form, which will be available very soon, to request the use of telephony or a fixed device from the state. And you're going to want to begin using the EVV mobile app as soon as possible with members. Now, for this, we're going to be releasing a checklist for you that is going to help you with all the steps for this. Slide. Slides may be a little slow.
Can you see it, Brian?
Yeah, I got you. Communication resources next, right? Thanks, Joe. Yeah, I think I just had a little bit of a lag. My fault, y'all. So communication resources. I want to talk to you guys again about how it's best to communicate with us, because we get this question a lot. As a matter of fact, I just got a notification that says a question that says, hey, we weren't notified of training, and we just received this town hall notification. So guys, we do everything about EVV is fully transparent to everyone. We put it on multiple banner messages. So if you're looking at your remittance advice as a provider, as you're required to do under your Part 1 Policy and Procedures Manual, it's not optional, then you would see that we have been communicating these resources as part of EVV information and communication to you. We've also been using our Twitter account, our YouTube account. our dedicated web page, which is that first thing here. You can also put in DCH, EVV, GA on any search engine, and our web page is the first thing that comes up. Everything is available on our web page. The training announcements, all of the presentations, recordings of all the presentations, all flyers and announcements, member and provider readiness surveys, frequently asked questions, town hall materials and recordings, as I said, all of them are available. So everything we have put out for the last 2.5 years, and we've been doing this for 2.5 years, communicating with the provider community, and they are all available online. Yes, we're going to talk about web training today as well. The whole purpose of today's training is of today's town hall is to specifically talk about training. So that was a big point, but everything we've been doing has really been training. So I want you guys to really take away from this that you really need to be focused on keeping up with that website. So you really need to be focused in on that website and looking at that website all the time. The last point I'll talk about with communication resources is we have a dedicated email address for any inquiries you may have. So if you want a personal response to any question, if you want one-on-one time where we set up and talk with you, then that is available via the EVV mailbox. So you can email us at any time, and we will discuss any topic or answer any question you have. Next slide. Okay, now I'm going to be quiet for a little bit and hopefully get a drink of water so my voice doesn't sound so froggy. And I'm going to turn it over to Joe Schnurr, who is the Chief Customer Officer for TELUS. Take it away, Joe.
All right. Thank you, Brian. And hello, everybody. Happy Friday to you. I hope everybody had a great week. And we do really appreciate you being with us today. It's great to be with you. And as Brian had mentioned, we're going to go through all the different ways that you can access training for the new EVV system. Okay, so I have a few slides to share, and then I'm actually going to do a demo for you and take you to the sites where you access the training and see the content. So the first thing I like to share is just best practices. And this is from our experience at rolling out this EVV technology in multiple different states and with literally tens of thousands of different providers that are using our system. So the first thing I always like to mention is, when should I take training? And as Brian mentioned, we're going to open it up to start very soon. In fact, on the 16th of this month, which is less than 2 weeks away. However, what we have found is that it is most productive for users to go through training when they have access to the application. So after you register and you can log in, then if you go to training, then you can actually apply the training to the system. However, some people like to get an early start, and that's certainly not a problem at all. We will gladly train you early. In fact, you can attend our training multiple times. We do ask, if you do come early, we do ask that once you do get into the application, that you go through the training again. And the reason we ask that is because you will forget some things, maybe some really important things. And in order to avoid you just getting frustrated because you forgot how to do something, we ask if you go through the training again once you now have the application. Okay, so next is on how do we deliver the training. We've also learned that people learn in multiple different ways. So we provide the training content in multiple different ways. So the first one is we do live webinars, much like we're doing here, where you would register for and log on to a live webinar with one of our trainers, and we will walk you through the application, and you're allowed to chat in your questions and answers. Again, very much like the environment that we're going through today. And providers that really like to engage and ask questions, they prefer the live webinars. Now, we also tape or record those webinars, again, just like we're going to do today. And if you miss part of it or all of it, we do post that on our training website, and I'll show you that so that you can listen to the recording, because maybe the live webinar's not at a good time for you, and so you would much rather listen to the recording maybe before you start your busy day. So all that's going to be available. Now, we also do what we call on-demand training, and those are short video snippets that allow you to learn certain things, certain parts of the technology broken down into shorter, more consumable pieces. Because another thing that we've heard from providers is, I don't always have an hour to sit on a live webinar, but I might have forgot how to add a user, and can't you just give me a 7-minute video on how to add a user? So we said, well, that makes sense. So we created those videos, and you'll see, I'll show you those today. Well, I won't show you all the videos, but I'll show you where you can find them. And they're very easy to access, and again, on there, on demand, whenever you need them. We've also heard from providers that they like to be able to pause the recording and then go into the application, perform the step, go back to the training, learn a little bit more, go and perform that step. So again, the recorded videos allow you to do exactly that. And then lastly is user guides. And some people that still, they prefer to read and print it out and have something in their hands. That's what we use the user guides for. So I'll show you how you can access those, and you can print them out or parts of them. Very easy to use as well. Okay, so this is just a little more explanation of what I said. So the live webinars, like I mentioned, they're recorded. You'll see that a pretty consistent theme across all the training is that we break it down into different modules, because it does depend on the type of user as to which module you're going to use. So for example, a caregiver is going to use the mobile module. The caregiver typically won't be submitting claims, so they would not go to the claims. They also probably would not go to the admin portal. So that's why we break it down into different modules. So therefore it aligns with the different types of users that we have. For the live webinars, I'll show you where the registration website is and how you can sign up. Very easy to use. For the on-demand videos, again, I'll take you to the website so you can see where those are at, and same with the user guides. This is a general idea of what I was saying, how we broke down the videos into the shorter length. So this is just to kind of give you a general idea of what I'm talking about. So you can see they're broken down into the modules: administrative console, mobile, claims, and then within that, there are these short videos. There's actually more than even listed on this page, but I wanted to at least give you a general idea so you had an idea how it works. So for example, if you forgot how to schedule a visit in the admin console, there's a video that will show you how to do that. Okay, so when is all this going to start, and what are the dates? So what we do is, and this is all for the live webinars, because obviously everything else is on demand and you can get it anytime you want. However, the live webinars are specific dates and times, and you do need to register for those webinars. So what we do is every Tuesday, we have a live webinar on mobile. Every Wednesday for the admin portal, and every Thursday for claims. So you can see that every week we're going to be repeating this training. And again, you can come as many times as you want. If you're super excited, like all of us are, about EVV, you may be on the first week. And again, after you get access to your application early in April, we do ask that you probably join the webinar again just to make sure you get a refresher. So again, lots of opportunity to attend the live webinars. All right, so at this point, I am going to switch over to my website so I can actually show you. And Brian, I don't know if you want to take a question maybe while I'm jumping over.
Yeah, I'm gonna answer one question because I don't want this member to continue, or this individual to continue on the training if they don't need to. So we did get a question that said private pay assisted livings don't have to use Medicaid. Is EVV, I mean, don't have to use EVV. Medicaid is just for EVV. EVV is just for Medicaid. I'm sorry, I'm switching up the words in your question. So yeah, EVV is just for Medicaid. If you are 100% private pay, then you would not have to be mandated to use an EVV. There's nothing in licensure that says private pay assisted livings have to use an EVV. It is a requirement for Medicaid for community living services and personal support services. All right, switching back.
Okay, great. Thanks, Brian. You can see my website?
Absolutely can, yep.
Okay, great. All right, everyone. So I am on the fortellus.com website. This is our main website. You could go there today if you would like. There's lots of information on EVV, but the main reason I take you here is if you page down just a little bit, you're going to see training webinars. You can also get to it under the resource page up here. There's a drop down for training webinars. They both take you to the same spot. So I'm going to go ahead and click on the training webinars. And then that's going to open up another page. You can see it's fortellus.com/training. You could just type in that page if you would like. Either one will work, whatever's easier for you. And then you can see I'm on the training webinars page. And if I just page down a little bit, you're going to see those modules that we talked about: admin console, claims, mobile, and maybe some extra topics. And if you page down a little bit further, you'll see that under each of these areas, these modules, we give you a little bit more information. We tell you who should attend the modules, and then what should you expect to learn. We also have some buttons over here on the right, and you can see as I hover my mouse over them, the little finger comes up so I can click on it. So there's one for register now. So I'll go ahead and click register now. And what it's going to do is it's going to open me up to my webinar registration website. The first thing you'll do is, what are the dates and times that it's available? You can drop this down and you can select any time. So there's, say, March 17th. And then there are required fields that we need in order to collect information so we know who's attended the training. And so you can see if there's a little asterisk next to any of the fields, then I do need to fill that field in. So I just click in the field and I can fill in all my information. So first name, last name, email address. We do need to know what state you operate in, what organization or agency that you might be part of, a phone number, and a job title. And then you basically come down here and you click register. And then just like any other webinar, you will get an email that gives you the invitation to that webinar. So hopefully you find that to be pretty straightforward and pretty easy to use. So if I go back to the training webinar website, I'll just go down through it just so you can see. So the same exact thing for claims. Again, we tell you who it makes sense, really the administrator, those using the admin console, and those doing the billing. and you'll learn how to review, modify, and submit claims for reimbursement. Again, you can register, you can view the recording. This one is in English, and those that need to access it in Spanish, we also have a Spanish recording as well. Same with mobile application. And then there could be some extra topics that might be relevant for you. Sometimes they're for other states, so you can just ignore those. One other thing I'll mention is that we do a live Q&A once a week, and that's just for providers that you just might have a specific topic, might not be even training related really. And we give you an opportunity to join that live Q&A and chat in your questions. Now, we'll tell you, most of it is training focused, and we do quite a bit of training in those sessions. Right now, we hold these once a week on Tuesday. So it just provides a weekly opportunity for providers that just want to come on and ask some questions. This is just another way to access us. And then you can plan that into your schedule. Okay, so that is the live webinars. Now I'm going to go to the, let me get into the application. All right, so I'm going to log into my dashboard. Okay, so for those of you that sat in on some of the previous town halls, we went through this webinar and explained the dashboard. And again, I would encourage you that if you missed any of those, I would encourage you to go back and watch the previous town halls where we went through the mobile application. We went through this dashboard in depth. We went through every part of this menu over here on the left. And we even went through how you will submit claims once we get to that part. So again, all of that is on the website, and all those recordings are there. So the one thing that we said we would cover later in the training is this training category down here. So right on your home portal, you're going to have a link to training. So I'm going to click on that. And then there's a button here that just says go to training. I'm going to click on that. And it's going to take me to another training resources website. Now what it did is it actually passed my password over and signed me in. So this site does require that you have a sign-in. So after registration, that's when you will get your sign-in into the TELUS platform. So you will not be able to access this site until you get that username and password. The training webinars you can access today. So I just want to make sure that I differentiate between that. So what's on this page? So if I tab down, you'll see user guides, video tutorials, FAQs. There is a link to support, and then this training webinars, which basically takes me right back to the page we just reviewed on the live webinars. And we are going to put the live webinars or the recordings on here as well. Right now, they're available on this site. So let's go through some of this information. So user guides, let me click on this button. And when I do, it brings me to the user guide page. And then you can see, again, by the different modules, admin console, claims, and mobile, I have PDFs that are available to view and download in English and in Spanish. So you can see for each module, it's available in English and Spanish. So if I click on view the PDF, so I'll do that for the mobile over here, it's going to open up the user guide for the mobile application. And you can see it gives you a nice contents of what I can find and the page number. It also allows me to click very easily into any of those pages just by clicking the page or that link, and it will take me exactly to that page. If I click on the mobile app, it'll take me back to the beginning. So rather than have to page and scroll down all the way through, you can just find out what it is you're trying to do, maybe preparing for a visit, and click on it. Will take me right to preparing a visit website, and then you can see there's subcategories, and again, I click on that and it brings me right to that page. So hopefully you find that pretty easy to use. Again, if you want to print out this page on how to view your recipient's notes, then assuming you have a printer, you will be able to print it out just like you would any other PDF. Here's the little print icon up here in the upper right. So that is the user guides. I'm going to go back and I'm going to page back to take me back to this previous page. And now I'm going to click on the video tutorials. So the video tutorials is that those short videos that I was telling you about, that if you forget a certain component and you just need a quick refresher, you can come here. Again, we have it in the same modules. So hopefully you find this to be a very kind of common look and feel so that you can get used to using this very quickly and easily. And you can actually click on the view videos and it will just push you down the page. You can also page down if you want to by sliding the bar here, but it just slides you down to your area. And you can see under claims, there's a whole bunch of videos. This one's 14 minutes, this one's 4.5 minutes, and so forth. We have multiple different videos on how to do different things regarding claims, regarding the mobile application, and regarding the admin console. So again, I believe you'll find these very user-friendly and really a good resource that doesn't take up a big part of your day. If you forget how to do scheduling, in 9.5 minutes, you get a quick reminder by watching this video. So I believe that covers all the different ways that you can access training and all the different ways that we've broken the content down in order for you to consume it, whatever is most comfortable for you. So at this point, I'm going to go back to the PowerPoint so we can wrap up and make sure we leave plenty of time to answer your questions. Okay, and again, if I know I did go through that quickly, and if you do have any questions, again, like Brian mentioned, put that in the Q&A box, and we will likely have time to get to as many of those as possible. Okay, we did want to share a quick update on the third parties, because we know that some of you are using other EVV systems, which is not a problem. And we are busy working with all those third parties. And in fact, you can see all the vendors that we are working with listed on this page. If you have a vendor that is not listed on the page, then we need to hear from your vendor very quickly. So if you see down here at the bottom, if your vendor is not on this list, please ask your vendor to email us at integrations@fortellus.com. But I believe that we are engaged with all the vendors that you are using. We did color code them to give you an idea of what the status is. So every one of these town halls will give you an update so you can see where your vendor is at. So let me go through a few of these. So if they're in blue, that means that they've completed all the paperwork, the contracting that they need to do in order to get started on the process. If they're in this orange color, which there's only one, that means that so far they have declined to do the integration. So if that happens to be your vendor, you're definitely going to need to have a discussion with your vendor, because your data would not be able to get over to us for the billing, which is very important. If they're in green and they're underlined, which you can see there are a couple on this page, that means they've already submitted a test file to us, which is really step 2, right? Step 1 is they fill the paperwork out. Step 2 is they submit a test file to our testing system. And then we go back and forth until they can complete a successful file. And then they're really ready to submit us some, what we refer to as a production file, and they're ready to go. So hopefully that gives you a quick update on where we're at with the third parties. And Brian, at this point, I think I'll turn things back over to you.
Great. Thanks, Joe. And thanks for the overview of training. That's really helpful. Before I give you kind of an upcoming town hall and what's happening next, I do want to say what I said last night on the town hall presentation, that I have seen and had to witness or sign off on every single video of that list of short videos that Joe mentioned earlier. And I think there's actually about 30 of them. There were only 19 or 20 on that slide, but I think there's closer to 30 of them. They're all, for me, I'm not a reading learner. I'm not a long meeting learner. I have a lot of ADD issues myself. So those videos for me were extraordinarily helpful, because they were in short little snippets of 10 or less or 12 minutes that you could go through. They were very interactive. They really walked the user through the issue at hand, and it helped with the way my head kind of compartmentalizes things. I could go, oh, that's how you reset a password. I get it now. And then I could move on to the next topic. So we're providing you a whole bunch of different ways that you can do training, including the live webinars. But those videos will be very helpful to you initially, and for new staff and refresher training as you continue to use EVV. So what comes next? What comes next is town halls, more town halls. The big one is the registration town hall at the end of the month on 3/31 and 4/1. I know one of the questions that's in the box right now to be answered is, well, how do we register? Well, that's why we're doing a registration town hall, so you can get your ID and your logins and get everything set up. So we're doing those on 3/31 and 4/1. The rest of the webinars, the ones for May, June, July, and August, we're going to leave open. We're going to see what you guys want to talk about and what you guys think is most pressing, and we're going to revisit those topics. If we see things where we're like, people seem to be struggling with resetting their password, we may do a Q&A on resetting your password. It's pretty easy. I've already done it. It's just like resetting any password. But in case we need that, we'll make that a focus of a future town hall. But we're going to make sure we have a lot of time for Q&A so that everybody's in a good space with the system. So last thing, and then we'll get to Q&A, make sure you are visiting the DCH EVV events webpage on our webpage so that you get all the registration links. We do also put it out on your remittance advices. We do email blasts. If you signed up for the emails, we send those out. I think we got over 500 people now on those email lists. So those all go out as well. We put it on Twitter and Facebook and all of our different social media channels as well. But the easiest thing to do is just go to that EVV events webpage for future sign-ins. Okay, I think it's time for Q&A. Before I start Q&A, in case we don't get to all the questions today, just do remember that there is evv.medicaid@dch.ga.gov. Again, that's evv.medicaid@dch.ga.gov. You can go and submit an email question, and you will get an individual response to your question. Usually I do a lot of those on the weekends, so don't let it weird you out if you get an email Sunday evening or on Saturday mornings. Okay, let's go through. We've got almost 500 people on the webinar today, which is, I think, a record for us. So we might not get to all the questions, but I'll try and get to as many as I can. If we don't get to all the questions, we will include them in Q&As if they're not already on Q&As. A lot of the times, the questions we answer are already on a Q&A. Okay, first question is, will the system have the ability to capture vital signs? And the answer to that is no. The system doesn't capture vital signs. If we serve both CCSP and source, do we need to register both with TELUS? If you have different provider IDs, those are going to be different registrations. Again, the next question is about training. So just continue to check that town hall training. Joe went through the list of very many web like not one-on-ones, but the web-based trainings that are interactive. There was a big long list of them. Those training resources will come up soon, and you can feel free to get enrolled in those. The next question is, how do we bill during phase one if claim submission won't occur until late May? You're going to bill like you always bill. You will have the ability to continue to bill directly to MMIS just like you do now until July 1st. As of July 1st, it will have to go through EVV. If you do bill through EVV and not MMIS during the interim period, you won't be able, you can submit the claims to MMIS, but they're going to dupe out for already have being paid if they pass through the EVV system. So you can't get double paid. We have an edit in the system that ensures that won't happen. Okay, I'm skipping through a few because we've already answered them. Is EVV, okay, there's one that says, is EVV mandatory? We are currently using a different application. I think that question means, is EVV mandatory through TELUS? So Joe went through the list of third parties that have been approved. And we're working with many of the ones that weren't approved yet that we're still talking to, that were in the bold black font and weren't yet moved to the other font. That doesn't mean we're not working with them, but it is mandatory that EVV be done for community living services and personal support services, both. That is mandatory. So you will have to either use the TELUS system or a third-party application in order to use it. So we talked about registration, and that's how you will get access to the portal. Will TELUS have any training sessions that aides can attend? Well, everything is available in our training. The videos are available. The webinar-based trainings are available. All of that is available. So you can use that as you feel fit for training. Private pay residents in PCH. We already talked about that one. Training is only done in Spanish as of right now. The only two languages we are doing are those that are mandated, which are English and Spanish in the state of Georgia. We are working on the capacity to expand that, but right now it is just English and Spanish. That's a great question. If we do both Medicaid and private pay, does it mean we only need to use EVV for Medicaid clients? Yes, EVV is only relative to Medicaid clients. So for our purposes at the Department of Community Health and the Medical Assistance Plan, we're just about Medicaid. The division, there are other divisions. There's the State Health Benefit Plan for state employees. They do their insurance through DCH. And also there's healthcare facility and regulation. But for purposes of the EVV legislation, it is only relative to Medicaid, and it's only mandated for personal support services and community living services. Availability for training for case management agencies and their ability to view the system. So what we talked about in the opening portion of this is that the case management would be part of phase 2 that we will have effective July 1st. So the training for case management and their ability to view the system will be done. There will be training and we will have them registered and set up, but it won't be till phase 2, which is at July 1st and forward. Will I please address which of the trainings participant directed employers need to attend when using Acumen as the fiscal agent. We have not received any notification of changes. We have been using the EVV system for several years. So that's a great question. We've done a lot of work talking to participant-directed individuals this week. And as I said at the beginning, we will be doing specific town halls, not town halls, but really focus groups just for the participant-directed members and their fiscal intermediaries at the end of the month. We did address with Acumen yesterday. They let us know that they had a focus group already with many members that they've been working with for 2 years on communication of the EVV system. They are working right now to ramp up their communication. They're going to put together a frequently asked question for participant-directed services, get together some training, and also update their website so you will have that information as well. So all of those resources and all of the resources that are available now to everyone will be available to you for EVV. So the next question is to Joe, but I'm going to answer it myself. I think you answered this already, but to make sure case managers will be able to access the aide's arrival, departure, and work assignments. So yes, our plan is for the case management entities for their specific members and nobody else to have a view window into the services that are being delivered by the agencies. When do we get our user ID and password? That's upon registration. Then there's a question about self-directed care that I believe we've already answered. So the training will be jointly done by DCH and Acumen. We're both going to work together to make sure that you guys are up to date on if there is anything that is needed to be done, that you are fully aware of that. So that's going to be a joint effort between both of us. But I have tried throughout this process in the last 2 years to make every single stitch of information about EVV available to everyone. I've been doing Medicaid now for 23 years. And one of my major goals was not to hear the normal complaint that I hear all the time that we're not making everything available. Y'all be able to say lots of things about me, but you won't be able to say that about EVV. Everything is fully available to everyone on our website. We are completely transparent with all of the information. So I don't want to exclude participant-directed members from all of the trainings and town halls that we have. I want you to be able to access the information that everybody has. And if you don't feel that it's relevant to you or a topic's not relevant to you, then you don't have to attend. But I still want to make sure that it's available for you. So I have another question about how will we know about the participant-directed focus groups? Well, we're going to do that through the same ways we do everything. It's going to be available on our website. The fiscal intermediaries are going to make it available on their websites and put out information about it as well. We're going to use our Twitter account and our banner messages and everything else to make sure that you are aware about those participant-directed meetings. The next part of this question is has telephony been approved for participant-directed through Acumen? It has, but everybody who is not going to use the app on a phone will have to be authorized by the state of Georgia for using an alternate method of EVV. So we're going to have a form that will be available online very shortly for you to submit to the state with the reasoning why you can't use an app. What's the criteria for using telephony? It's not as broad as living in a rural area. If your employees don't have smartphones, if there's no way to contact them when they're with your member, then that would be something we would want to have put on the form. The next question is this only for CLS? Do we need to differentiate between CLB and CLE? So CLE and CLB are just Community Living Supports Basic and Community Living Support Extended. They are two differentiations of CLS, and yes, you will delineate that on your schedule. So your schedule will say which service is which, and that will cue into your clock in and clock out. Again, this is not for CAI. So when your CLS, whether it be CLB or CLE ends, you would clock out for that, and EVV would not be required for CAI. Yet we are working with Acumen. The next question is, well, we didn't see Acumen in green or in another color. We are working with Acumen. We're very confident that in the next week or so, we'll be able to get an attestation agreement with Acumen. We've been over how do we sign up through the registrations. If we create our own program, do we need to get integrated through TELUS? So you will have to have an EVV system. There is no cost to the TELUS system. If you have a third-party system, it will need to be integrated. Again, case management will, in phase 2, have access to EVV. So we'll take the question about your individual attestation. Your individual third-party attestation offline and pass that on to TELUS. There is a concern that the vendor has said that they have submitted the application, but they are not seeing it on the page. Does contracted vendor mean they're ready to go? Contracted vendor means that they have agreed to integrate with TELUS, but we have not yet done testing with them. So we have to set up testing with them to make sure that they will be ready to go when 7.1 mandatory claims processing goes through. Is it possible to get a copy of the presentation sent? Okay, so all of our presentations are available online. You are welcome to go there and pull them down yourself. So they're all on the web page. They're all available and openly available to you. So you can just get them there. You can either use the EVV system. If you are a provider, you can either use the TELUS system or you can have the ability to go through a third party, but you do not have to go through a third party. As far as the authorizations for services and eligibility service for the EVV system, that will be coming in a file to TELUS. So they will get a file from MMIS, and claim submissions as of 7.1 will mandatorily have to go through EVV to MMIS. But the authorizations for member eligibility and for prior authorization of services will be coming from MMIS through their normal channels to TELUS. I've already answered the question about Acumen and how we're handling Acumen. So I think I've answered that a couple of times now. Downloading TELUS as a mobile app, that's part of the registration that we'll do at the end of the month, but it is available out there on normal websites. But you really do need to be trained. So I would tell you just to hold off until you've had the training portion of this presentation at first. If you have an approved vendor, but the next question is, can we use TELUS for some of our folks and a third-party vendor from others of our folks? No, we're going to need you to use either one or the other. The next question is, will case management be able to view our site? Case management will be able to view the information for the members they serve and be directly contacted by the members they serve. If you have different provider IDs, you will have to have different logins. So the next question is that you reached out to TELUS and you would like to use them as your EVV vendor. So then you would just go through the register and process as any vendor through registration and set up through the EVV registration. Next question is structured family caregiving. No, that wasn't on the list. We went through this. So only the services that are on the list are covered by EVV. Sometimes I think y'all just trying to test me. So those services are community living services and personal support services. No other services are covered under EVV, including structured family caregiving, community access group, community access individual, any community residential service, Alternate living services, none of those are covered by EVV. It is just personal support services and community living services. Again, I want to assure everybody that when it comes to Acumen and DCI, we have had several meetings with them. We're in constant communication with them. We are very much confident that we will have an attestation agreement with them next week or shortly thereafter. Will it alleviate the need to use client service record forms? It will eliminate the need to do any documentation that is covered already by EVV for these services. If there are additional things in the client service record form that isn't captured by EVV, you will still need to document that. Is limited English a reason for telephony? You can certainly submit that to us and we will investigate that. There's more questions about individual providers, so we will follow up on those to see. I will say WellSky is we use for our prior authorizations. If you're also using them as an EVV vendor, they would need to go through and sign up as one of our EVV vendors as well. EVV is not used for skilled nursing. It is just used for PSS and CLS. The apps are going to need to be kept by the caregivers. Again, the registration training is at the end of the month. So go back and review this presentation. So if you do have somebody who is receiving 24 hours in a row of CLS, then it is required for them. EVV is required for all CLS. It is required from all CLS, regardless of the number of hours. There's a question if we've heard from Continuum. Yes, ma'am. We have been working with Continuum and PCG as well. We have been working with all the fiscal intermediaries. When you have a third-party vendor, that third-party vendor needs to connect with EVV as described in this presentation. Yes, if you have 6 provider IDs, that means you have 6 logins. That is correct because you have 6 provider. Now, I'm questioning if those are 6 provider IDs for 6 different locations. So we may need to look at how you're registered. So I'm going to assign somebody to do that. If we have a client that receives both CLS and CAI in the same week, can we submit the CAI through? No, for the state of Georgia, we only are concerned about CLS and PSS. That's all we've paid for. Now, if this is a participant-directed person and you are working through Acumen, my understanding is that Acumen would like all individuals to move to the DCI system for electronic submission for all of their services. It's a benefit to you and it's a benefit from them because it's a much cleaner process than paper timesheets. That's what we've heard from discussing with them. So you may want to reach out to them as far as if you are a participant-directed member. If you're not and you're a traditional provider, we only provide EVV for PSS and CLS only. When is EVV implemented? It's going to be live 4/1 and it's mandatory for claims processing on 7/1. You will bill for the other services, including skilled nursing or group or adult day health or any of the other services, just as you always have. There will be no change in how you do the other services. Yes, there is face-to-face training for providers. In the middle of a pandemic, we're not going to do it in the same room, but we do have those interactive webinars that Joe talked about earlier. Okay, that's all we have time for today. We're at the time. I want to thank everybody for joining us today and all the questions. We learn a lot from your questions and it helps us do a little bit more investigation in certain circumstances. So thank you so much for your input. I hope everybody has a wonderful rest of their day and a great weekend. Make sure you're still watching that website, and thank you.
Thank you.